Imagine you have a bad toothache. You can't stop thinking about the pain day or night, but you cannot afford to call a dentist. Where can you get help? Healthcare in the United States is the best in the world for those who can afford it. We're also comforted that our hospitals provide a safety net for the poor. It is true, even if you are poor, even if you do not have insurance, you can walk into any hospital in the United States and receive medical care. It's not a good system, but it is there. But we forgot something. We just completely overlooked one critical body part. How odd. We forgot dental care. We lack access to care for this part of the human body for almost all adults who cannot afford to pay for dental care. Once a year, the Northern Virginia Dental Society sponsors a Mission of Mercy, or MOM, project. Over the course of 2 days, over 500 local dental professionals and community volunteers donate their time to treat over 750 adult patients, knowing it is a small percentage of those who need care but are determined to do what they can. And once a year, patients line up early in the morning at the Northern Virginia Community College Medical Campus in Springfield. The following scenes are from a recent MOM project.
An acute care clinic for 2 days, once a year. You don't realize the need that's in our own community. We always look at, what's going on in the third world countries. You have Haiti, you've got, South America, you've got Wise County too. But here we are in Northern Virginia, which is, very affluent. But the same need is still here. We have homeless people. We have people who can't make enough to feed themselves, and they have the same dental needs that everybody else does.
This is the first time I've actually been helped through the Mission of Mercy.
It's not just the teeth. If you have infection in your mouth, it's going to affect your heart. It's going to affect whether you have and increase the problem that you might have with diabetes. So the whole body is connected.
There is scientific data confirming the direct link between poor oral health and for specific chronic long-term illnesses.
We have pregnant women who have no insurance, who are having premature babies, who end up in the neonatal intensive care unit because of abscesses that they had during pregnancy, and they can't have them treated. We just don't have the resources.
In addition to that, let me just say that especially in the current economic times, individuals with deteriorated oral conditions oftentimes are unemployable or unmarketable purely because of their appearance.
But how am I going to be presentable to get a job, to get my life, going, to be productive in society? I mean, how can I smile? I walk around with my head down all the time, and I love to smile. I had the most beautiful smile at once.
And I just feel uncomfortable looking for another job or communicating with people. It affects your self-esteem directly. You don't feel comfortable. When I'm talking to you or anybody else, I'm always trying to hide the fact that that tooth is broke. I don't want you to see that tooth because it affects my self-esteem directly.
It's really going to change my life as far as being a mother, because I've been in so much pain that I can't really, provide 100% of my energy and my attention to my son, which he needs the whole 100%. So to be able to get this done is really going to help me out a lot and help him out too as well.
It holds me back tremendously.
It does.
If I could get teeth, it would turn me around.
So what happens if you can't find affordable dental care in this country? For the most part, you do without. A dental cleaning in Northern Virginia costs an average of $100. A set of x-rays will run you $130. Fillings range from $200 to over $300 per tooth. Having a single tooth extracted will vary from $250 to $400 depending on the complexity of the operation, and root canals cost from $1,500. These are costs low-income adults and families simply cannot afford. There are a few safety net clinics that do all they can, but there are not nearly enough of them, and they have long waiting lists. The people who most need the help are the working poor and unemployed adults. These people take care of our children, deliver our pizzas, wait on our tables, and live in our neighborhoods.
In fact, I just know it hurts really, really bad.
How
really
long
bad.
has it been hurting?
It's been hurting like this for about 4 days. And I've been calling around trying to see if I could get discount dental or payment plan or, yeah.
And yet there is no way to treat their dental care. It's a shame. We could keep patients out of the emergency rooms, out of hospitals. We could keep them on the job because these are the working poor. These are people who are employed, who are doing great service in our community. And this is really a hidden problem that is causing them not to be able to go to their jobs, children not to be able to go get their education. And we are all affected by it.
You know, when you go look for a job, and the first thing they're looking at is your smile, your mouth. And if that's messed up, it sends a message, whether it's true or not, that you're not taking care of yourself. You know, and so how can he expect you to be responsible worker for him if you're not responsible for your own self?
You know, and when I've done some patients down here in the clinic, same kind of thing. I can think of one gentleman who, his front 6 teeth, all they had were decay, and all you saw were these brown ovals or brown circles. And just, he didn't want to smile. And, you know, he'd take something to drink and everything hurt. Well, the teeth were fixable.
And dental care is very important. It's like right now, I'll be 50 soon, okay, and I do daycare, and I want to go and get a part-time job or whatever. But if you don't have the smile, you don't have the look, you know, your dental is actually your youth. You know, if you have a healthy smile, it makes you look a lot younger, makes you feel a lot better about yourself. Right. And then you're more productive if you feel better about yourself, you know.
This is a great organization, you know, that puts this together, and all the volunteers here are wonderful, you know, to provide this.
Dr. Peter Kokolis, the mom chair, described the number treated at the Springfield Mom as a drop in the bucket compared with the need. How large is this bucket? One way to measure it is to estimate the number of adults in the area who need dental care and who have incomes below the limit set by the mom. This limit is 2 times the federal poverty level, a level that varies by family size. For example, in 2011, it is $21,780 for a single adult and $44,700 for an adult from a family of 4. A recent estimate based on U.S. Census data of the number of adults below this income level in Northern Virginia was over 230,000. The National Center for Health Statistics reports that 40% of adults with incomes below this level have untreated cavities. 40% means that 92,000 have untreated cavities, or 119 times the number cared for at the Springfield Mission of Mercy. How can we do a better job of closing this gap?